Hey guys, what's going on? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to hit that subscribe button so you guys are updated on hair loss and hair transplant topics. Visit my website at hairliciously.com to purchase your microneedling device, which is scientifically proven to stimulate hair growth. My low-level laser derby cap, the debunking shampoo and serum, hair growth vitamins, and a few other products for those who are suffering from hair loss. Hey guys, I apologize. I've been feeling a little bit under the weather lately and haven't really been able to post as much, but I am back here with another video. And today I actually want to share with you an incredible reversal of hair loss from a guy who posted his 9-month results on Trestless after being on hair loss medication. In fact, he initially had planned to go to Turkey to get a hair transplant because his hair loss was rapid and severe, but the results from the hair loss medication that he was taking were so good and effective that he actually ended up canceling his hair transplant. He goes by username Don Stelio, and he shared with us a bunch of before and after photos. This is his baseline photo in May of 2020, and during this time, he actually had booked a hair transplant for November 2020, but he canceled it in September as he continually saw great results from his hair loss treatment regimen. But looking at his baseline photos before any treatment was done, we can see some moderate hair loss on the temples and mid-scalp as well as on the crown. His hair is looking relatively thin, and he would be well on his way to, a Norwood 6, potentially a Norwood 7, had he not started hair loss treatment medication. The hairline and temples are also non-existent, and he has what we typically call the island on the mid-frontal portion of his hairline that will eventually miniaturize. There is a good possibility that further miniaturization will continue to advance and he's just going to be left with a rim of hair. Now, the next few photos are the results of just 3 to 4 months of treatment, which is incredible, and we can easily see a lot of the density that has increased and improved to his hairline, particularly the temples and the frontal mid portion, which have filled in really nicely. I think that most people are typically going to start seeing initial results around their 4 to 6 months of consistent treatment. And it's also not going to be uncommon for people to start seeing results after around 8 to 9 months. I think being consistent is the key here. And it looks like this guy is a good responder and should definitely see, more improvement as the months progress by. He did also share with us his exact hair loss treatment regimen, which is going to consist of microneedling at 1.5 to 2 millimeters every 7 to 10 days. Minoxidil Max Estrogen 6 once a day. This is a topical combination of Minoxidil 6%, 0.05% finasteride. And I will emphasize the fact that he waits 18 to 24 hours after needling before applying the topical to avoid it going systemic and causing unwanted side effects. And lastly, he does also use Nizoral shampoo 2 to 3 times a week. I covered a video on the optimal microneedling length a few videos ago, and based on my research from prior studies, the best needle length seems to be between 1.5 and 2.5 millimeters because the hair follicle stem cell bulge is located in the dermal layer, which is situated between the two lengths. And this is where you guys actually want to cause wounding. Anything under 1 millimeter is typically beneficial for topical absorption, at least for those who are not prone to getting sites from applying a topical solution right after, microneedling. So this guy microneedling at 1.5 to 2 millimeters every 7 to 10 days to allow for wound healing is doing it correctly, at least in my opinion, to stimulate growth factors. A lot of the questions I get when it comes to microneedling has to do with the depth and more so the pressure that's being applied. And honestly speaking, to this day, there really hasn't been any clear-cut answers that explains what the most optimal pressure is. But the guy shares his experience and he says that he actually microneedles the whole head, but focuses more on the frontal half. And he goes vertically 10 times in straight lines, and he does it horizontal direction and finishes it off by doing it diagonally. He also states that he did used to bleed at 1.5 millimeters. And then after a while, I guess the bleeding just stopped and he eventually worked his way up to 2 millimeters. Part of his bald temples at 2 millimeters get a little bloody. And he also mentions that there is a few blood spots in the scalp. That does occur if he kind of goes over the same area a little bit too much. But after 24 hours, redness subsides. And, just like most studies on microneedling, the goal is to achieve a minimum of erythema in the area and also pinpoint bleeding. And it seems like for most people, this is going to suffice. I honestly think that it's best for people to work their way up instead of jumping straight into a 1.5 or 2 millimeter. That way you can kind of get used to, the pain and also get used to microneedling on a weekly basis. And this is what this guy did. And honestly speaking, the pain isn't something that hurts terribly. I think that most people can just kind of push through the pain. But, you guys can actually use a topical anesthetic cream or spray to numb the area prior to microneedling. The Minoxidil Max Estrogen 6 is something that I've not heard of. but apparently it's a topical he's been using with 6% minoxidil and 0.05% finasteride There's a lot of different companies and compounding pharmacies and concentration variations for these topical solutions that incorporate both minoxidil and finasteride. And the reason why this guy is going the topical route versus oral finasteride is because of the side effects that he had from taking oral medication. He stated that he did take oral finasteride for about 18 months. He eventually had to stop due to unwanted side effects. I also covered a video on topical versus oral finasteride and how both are effective at inhibiting the conversion of testosterone to DHT. But we do know that oral works better as it goes more systemic, and it also inhibits more DHT versus the topical application on the scalp. You know, a topical is a good idea for those who may be more prone to side effects from taking oral finasteride. And apparently, you know, this guy has been seeing some pretty good results with the topical version. This isn't to say that those who are on topical finasteride won't see any side effects, but rather, I think the possibility of sides from taking topical version are going to be more reduced, as it doesn't go as systemic as much as it does with the oral tablet. And just to kind of, you know, make the record straight, you know, most people who are on oral finasteride are not going to see side effects. It's very unlikely. The drug has been tested for decades and FDA approved, and it's one of the best, you know, one of the most well-researched medications that can slow down further hair loss. And I myself haven't taken it for a few years now without any side effects. So I would highly recommend that you guys consider finasteride, oral or topical, whatever it may be, at the bare minimum before considering other treatment options. The last treatment he mentioned is Nizoral shampoo, also known as ketoconazole, which is the main ingredient. And this is an antifungal treatment. It can be effective for people suffering from dandruff and scalp inflammation, but unfortunately there are a limited number of studies on its direct effect in treating androgenetic alopecia. So oftentimes most people don't use it as monotherapy, but rather they combine it with finasteride and minoxidil to have more of a synergistic effect. I've seen other studies that show that ketoconazole can act as a mild 5-alpha reductase inhibitor, but more studies do need to be warranted. And like I said, the shampoo by itself won't really do much to treat the root cause of genetic hair loss. And finally, after 9 months of consistent hair loss treatment, he shared with us a few photos from various angles of his current hair under direct room light. And as you guys can see, we can definitely see a tremendous improvement to not only the density, but also the fact that he was able to regain his hairline back. I think this is the most important thing. His crown also looks very good with minimal signs of thinning. And to be honest, he's now more at a Norwood 2.5 maybe, or Norwood 3. The overall condition of his hair also looks pretty healthy and definitely so much thicker than what he started off from. Because before we were able to see right through his scalp, as he was just left with wispy hair in the island portion of the frontal hairline, and his temples were also receded, you know, far back. But his results showed, you know, drastic improvement for just 9 months of treatment, and because, you know, he did not jump right into a hair transplant prior to taking hair loss medication, he was actually able to save at least, you know, a few hundred, or if not, at least 1,000 grafts. I definitely would attribute most of the growth to minoxidil and microneedling, because before he did mention that he did take oral finasteride for about 18 months without any noticeable differences other than getting side effects. But after he did incorporate topical finasteride with minoxidil and microneedling, he ended up seeing some drastic results. And studies do confirm the efficacy when microneedling is used in conjunction with minoxidil. Up to 4 times more hair is possible when the two are used synergistically. So definitely they have to go hand in hand for anyone who is looking for an effective hair loss treatment that may help improve density. Anyway, he did mention later in the post though that he still does plan on getting a hair transplant later down the road to get a hairline closer to a Norwood 0 and also to fix the temples. You know, overall, you guys saw the results. Kudos to this guy for sticking with his hair loss medication first before considering a hair transplant. I think that, you know, a lot of guys, you know, myself included, just kind of jump straight into a hair transplant without considering trying out different, you know, hair loss treatment regimens prior to getting a hair transplant. Some guys will respond favorably to treatment, and therefore they can, you know, like I said, at least save a few hundred grafts at the minimum. But I think the majority of the people who are suffering from androgenetic alopecia are going to want something more permanent, and medication oftentimes is kind of viewed upon as something that acts more as a preventative measure rather than focusing on, you know, and it as a means of regrowing miniaturized hairs. There are obviously going to be some hyper responders to treatment that I've shared on my channel, you know, from using finasteride, microneedling, who are literally able to reverse hair loss, you know, completely, going from a Norwood 5, Norwood 6 back to like a Norwood 2. But we all know that those examples are typically going to be the exception of the rule. And for the vast majority of people taking finasteride or dutasteride with, you know, minoxidil, microneedling, laser therapy, ketoconazole, they may see some noticeable improvement, but it's not to the point where it's going to be enough to not be enticed by a hair transplant. And with that said, it's important to actually be on medication prior to getting a hair transplant so that your native hairs are stabilized and the chances of the surrounding native hairs are not going to be affected as much to shock loss. So I definitely would recommend this guy getting a hair transplant, but I would not advise him to obtain a Nizoral type of hairline as he indicated, only because he did have a aggressive form of hair loss to begin with, and there's always the possibility that even hair loss treatments, especially the ones that he's on, could potentially lose efficacy over the years as his hair follicles become more sensitive to androgens. And as you guys know, topical finasteride doesn't seem to work as well as oral. And even if you were taking oral finasteride, it doesn't completely inhibit the conversion of testosterone into DHT. So there are still going to be circulating, DHT and elevated levels of testosterone that can continue to cause havoc and cause further, miniaturization. He's also not really addressing the androgen receptors, which would protect his hair follicles even further if he were to incorporate some type of anti-androgen. But if I were to give this guy my personal recommendation, he would be better off just getting a more conservative type of hairline through a hair transplant and just increasing, some of the density on thinning areas so that he can save grass in consideration for potential future, hair loss down the road. But overall, this guy has shown some pretty promising results after just 9 months of treatment. The key ultimately is to be consistent with any type of hair loss medication and treatment, because hair loss medication and current hair loss treatments like microneedling, finasteride, dutasteride, laser therapy need to be done long-term in order to maintain any growth that has been achieved. And the moment that you guys actually stop, most if not all of the gains are going to be lost. So, ultimately it's promising to see results like this guy has seen because it really shows the potential and efficacy of 5-alpha reductase inhibitors paired up with a growth agonist like Minoxidil and microneedling can bring about, and also reinforces the fact that anybody who is suffering from androgenic alopecia should definitely incorporate these 3 treatments into the regimen and try to be consistent with it. But that's all I have for today's video, guys. Let me know your thoughts on this guy's hair loss treatment regimen, and if you have any questions, make sure to leave me some comments below. Thanks for watching, and I will talk to you guys in my next video. Take care.